Choosing the right ECG terminology, left atrial abnormality versus others. Same discussion applies to right atrial abnormality as well. Left atrial abnormality is the most accurate and guideline preferred terminology. The 2009 AHA-ACCF HRS recommendations for the standardization and interpretation of the electrocardiogram explicitly favor abnormality over enlargement, hypertrophy or overload. Here is the clinical rationale behind why left atrial abnormality is a superior term. The physiology of the P wave. An ECG records electrical vectors and timing and not physical anatomy. The classic criteria for this condition, such as a P wave duration of 120 milliseconds or more in lead 2, that is P mitral, or a prominent P wave terminal force in V1 more than or equal to 0.4 millimeters second, indicate delayed left atrial activation. This electrical delay can be caused by three distinct pathophysiological states. 1. Anatomical atrial dilatation, true physical stretching and remodeling of the left atrium. 2. Hemodynamic stress, elevated left atrial filling pressures like acute heart failure, mitral stenosis or diastolic dysfunction, increasing wall tension, which can prolong activation without necessarily causing immediate structural dilatation. Conduction delay. Interatrial block such as delayed conduction through Bachmann's bundle caused by fibrosis, aging or ischemia. This can occur in a structurally normal sized atrium. Terminology comparison. Left atrial abnormality. Implication and alteration in the electrical activation of the left atrium. Clinical accuracy high. It correctly describes the electrical reality on the ECG without incorrectly assuming the underlying anatomical or hemodynamic cause. Left atrial enlargement. A physical increase in the dimensions or volume of the chamber is the implication. The clinical accuracy is low. The ECG is an electrical tool with poor sensitivity for true anatomical enlargement. Echocardiography or cardiac MRI is required to diagnose physical enlargement. Left atrial overload. Implication elevated pressure or volume load within the chamber. Clinical accuracy is incomplete. While elevated filling pressures can cause the ECG findings, the term excludes primary conduction delays, that is interatrial block, as a potential cause. Using left atrial abnormality prevents overstating what the surface ECG can actually confirm, properly leaving the definitive anatomical diagnosis to imaging modalities like echocardiography.